Welcome to you and your family. Bienvenidos a usted y su familia con su amigo y servidor Celso Mesías. Dear friends, unfortunately, our children are in danger. Today in America, about 1 in 3 kids and teens are overweight or obese. The rate has more than tripled in the past 30 years. Desafortunadamente, amigos, hoy en día en América, 1 de cada 3 niños o adolescentes está en peligro bajo una epidemia llamada obesidad, porque o tiene sobrepeso o es obeso, y el número se ha triplicado en los últimos 30 años. Es por eso que hoy día queremos tratar el tema de la obesidad en la niñez y en los adolescentes. ¿Qué podemos hacer como padres de familia o la comunidad en su conjunto para poder enfrentar esta terrible epidemia que amenaza a nuestros niños, a nuestras familias? So, in that purpose, we have today a special guest who are going to bring very important information about this topic, the children's obesity. And for this program, I want to welcome Beth Schwartz. She is a registered nurse and the Healthy Weight Management Coordinator for Lancaster General Health. She is the facilitator of the Community Obesity Prevention Coalition named Lighting Up Lancaster. She works with the Lancaster City and county communities to increase the number of children maintaining a healthy weight. Good. Also, we have Jessica Hilderman. Welcome to you and your family. She's a registered dietitian for Lancaster General Health. She works with our healthy weight management programs and teaches Learn and Shape Down. So both of you, welcome to you and your family.
Thank you. Thank you.
Beth and Jessica, we have an epidemic named obesity, taking more victims in our children, in our families. So what's going on? This number increase year than a year. What's going on?
Well, we liken it to, it didn't happen overnight, and we say that many times it has crept up on us. The problem of obesity has truly snuck up on us, and we have created a society where making the healthy choice is not necessarily the easiest choice. Many of us do not live within walking distance of a healthy shopping store or healthy corner store that would serve healthy, fresh fruits and vegetables. Many of us live in neighborhoods where we wouldn't send our children to ride their bike or walk down the street alone. We now have a society that values the car more than walking and the bicycle. So we have a society as a whole has a problem that stems the whole way up to the federal government, but down to the individual citizen. And so we at Lighten Up Lancaster work together with many different sectors, workplaces, schools, communities, government, to address how can we help people maintain a healthy weight, because the costs of obesity are staggering. Right now our country spends $147 billion a year in treating obesity-related medical illnesses, missed time work, missed at work, and the number is growing in leaps and bounds. And so we realize that it's going to take a community approach to change what has snuck up on us. Where we're going to move forward, we're all going to have to work together.
Efectivamente, que, como dice Beth, tenemos que tomar parte, no solamente como padres de familia en nuestros hogares, sino la comunidad en su conjunto, porque los efectos no solamente atentan contra nuestra salud, sino también la salud pública, sino que el costo también del gobierno, de los estados, por tratar de financiar lo que a veces es irreparable, porque definitivamente la vida de nuestros hijos está en riesgo con una salud quebrantada y si es agudizada por otros efectos que tienen la salud por el problema de obesidad. So, Jessica, what is the difference, or how you can define overweight and obesity?
Well, someone that is obese has a body mass index of 30 or higher. And a body mass index really is just a ratio of your weight to your height. So doctors can compute that for you as when you go to visit them, or there's formulas that are very easy to do the calculations at home. If you're not going to the doctor, you can find information on the internet or
our website currently has a BMI calculator where you are able to do it yourself, entering your height and weight, and it will show you where you fall on the BMI chart.
So that's obesity. For someone that's overweight, their BMI or body mass index is between 25 and 30.
So when we talk over the 30 rate, that means body fat in excess, right, of the regular person that can have some overweight can have more chance to control. But in the case of our children, it is really a big concern because this number is growing. So in specific, something is happening with the food that we eat or the excess. So how we can start there? How, as a parent, with the food? In one before we in one program, you said that the nutrition facts are very essential in the education for new habits. So what can we do at home and to treat this problem with our children?
Sure. One of the easiest things people can do is start to prepare more fresh meals at home versus going out to eat. That is a big way to improve the nutritional quality of the meals that you're eating. You have a lot more control over the nutritional value of the food items when you're preparing them than you do from going to a restaurant most of the time. And when you are maybe making a meal plan, that's another good way to start for the week. Beth, I know, mentioned in another program about laying out healthy meals for an entire week, getting a meal plan, and incorporating all of the major food groups so that they're well balanced and in the right amounts. They're not oversized. They're appropriate portions so that they're including all the nutrition that your body needs for health, and you won't overconsume the calories from having too much served to you from a restaurant or something like that.
So, ciertamente estamos consumiendo más calorías, de ahí el sobrepeso. By the way, you are really looking with a very shape and following your teaching and your education and how to eat healthy. So what I was saying is that in Spanish that the importance just to get in our menu less calories with fresh meals.
With fresh meals.
So preparando comidas más frescas y evitando concurrir frecuentemente a los restaurantes y comiendo fuera, que también lo podemos hacer, pero de manera más saludable, es el de considerar que ese exceso de calorías siempre estará fuera de nuestro hogar en otros restaurantes. Si consumimos lo que a veces nos tienta, sin considerar el valor nutricional de lo que se consume. Por eso, mucho cuidado con ello. Y en las causas de lo que produce el sobrepeso y la obesidad es lo que quisiera preguntarle ahora y qué nos pueda decir Beth. So, what are those most popular or important causes that produce the origin the overweight and obesity?
So beyond eating extra calories, which is the baseline, we're certainly not getting the physical activity many of us used to as children in this current society that we live in. So lack of exercise, lack of movement is a huge factor. Portion sizes we talked about earlier, that the actual meals served to us are served on larger plates than 20 or 30 years ago. One simple way we instruct our clients is just to purchase smaller dinner plates that you serve your guests and your family each evening, because it is very easy to overeat if your plate is full. So we start with go back to replacing those larger plates we all have now and go back to the simple sizes. And as I mentioned earlier, our environment is a big factor in creating the problems that we have right now.
Sí, una de las causas muy comunes es que realmente no tenemos mucho cuidado en servirnos la comida y usamos a veces platos más grandes de lo necesario, ¿no? Y que invita a que uno se sirva más comida. Cuidado con eso, o también el estar constantemente repitiendo el consumo de algunas comidas. Tenemos que tener mucho cuidado en ello. Also, definitely, eating in excess of calories and all these other causes that we have, like the lack of physical activity. That is another point that we have to take care, right?
Absolutely. And there are simple things. We tell people, do not feel that you have to go out and buy a gym membership, a costly membership to a facility. You can do simple things at home by building in walking a greater distance. When you park your car at a location, walk further. And simple things of, many families have a dog, making sure the dog is walked daily. Just as you want your children to get out, get yourself out with your pets. Simple things of gardening, cleaning, are activities that can be counted towards your physical activity. And one way our family particularly likes to build in exercise is hiking. We have created a guide, Lighten Up Lancaster has created a guide of all of the physical activity trails and rails to trails and parks for free that we will make available to you, that our family enjoys going on a hike, finding new things to do in nature. Another way that we can do something that's not costly, but we're moving and walking and the kids don't even realize how far we've hiked.
Correcto. Es evidente que la falta de actividad física es un factor también que causa el sobrepeso y luego la obesidad, sobre todo si estamos al mismo tiempo consumiendo un exceso de calorías. Recomendaciones simples, como por ejemplo el de que no es necesario el de ir a un gimnasio, sino el de poder simplemente, si va a su centro laboral, parquear o estacionar su auto no tan cerca de su centro de labores y puede aprovechar ese tiempo para poder caminar y tener algo de ejercicio. El ejercicio resulta ser básico también, o la falta de él, el que origina estos problemas. So, definitely we have health effects with the children's obesity. Can you tell us something about that? The risk of having all these diseases and problems in our health?
Do you want me to do that? Sure. For just carrying too much weight in general puts more stress on the body, and it causes an increased risk of developing type 2 diabetes, heart disease, stroke. Some cancers are related to obesity, and the earlier it starts, usually the worse it gets over time. So for a child to be at an unhealthy weight only increases their risk of getting one of these diseases, and when they get that disease, if they get that disease, it could be worse than it would be otherwise. So that's one of the main reasons to reach and to stay at a healthy weight throughout your entire life, is to avoid heart disease, diabetes, even kidney disease later, and some cancers.
So we can have immediate effects and long-term health effects. So definitivamente hay efectos negativos en la salud de nuestros niños o nuestra propia salud con el sobrepeso y la obesidad ya declarada. Y es que podemos tener no solamente una alta presión sanguínea, sino también problemas cardiovasculares, altos niveles también del colesterol, high levels of cholesterol too, right?
And blood pressure.
And blood pressure. So, son problemas que se van a presentar de inmediato, como también van a poder tener a largo plazo efectos en nuestra salud, como desarrollar un cáncer, o lo que se está lamentablemente creciendo y de manera muy común, the diabetes type 2 in teenagers. Is something that we didn't see before years ago, right? So, el desarrollar también la diabetes tipo 2 en nuestros adolescentes era algo que no lo veíamos hace algunas décadas atrás, pero en estos momentos el número es creciente, tomando más víctimas. So definitely we have also psychological effects.
Yes, I was thinking about that when you were speaking, and so many times there are self-esteem issues with anyone carrying extra weight. We know children can be bullied in their classroom or picked on different levels than other children. We recognize that sometimes these children do not have the energy or the stamina that some of the other kids do. They also can have sleep disturbances. So it really is an epidemic that affects us all on multiple levels. And so some of these simple activities and healthy suggestions for eating really can play a big part.
Thank you, Beth. También tenemos problemas o efectos psicológicos en nuestros niños que se van a presentar con la obesidad, y es que su autoestima sin duda va a tener un efecto en ella y va a tender a que pueda bajar, y que en la escuela o en la familia pueda ser sujeta de burlas o de ciertas molestias. So, esos efectos también, emotional effects and social effects. So, sin duda van a tener también efectos emocionales y sociales. But as professionals, healthcare, and nutrition consultants, or experts like you are working in our community and doing really a great job. How can we prevent all these problems as obesity and overweight?
Well, that is the exact mission of Lighten Up Lancaster, and if you would like more information, we ask that you go to www.lightenuplancaster.org, and you'll find all of the areas that we are working. We work in policies to work with government officials to look to create policies that would make it the healthy choice the easy choice. So an example would be, we worked with 3 different schools within Lancaster City to bring mobile markets to their locations last summer, that they would be able to have a stand selling fresh fruits and vegetables. And that was a policy change that we needed to change at the governmental city ordinance level. And so as a result, this summer we are also, just to let you know, we are also going to have a mobile market at the Spanish American Civic Association Center on every Wednesday from 9 to 2 o'clock this summer.
You mean SACA?
SACA, thank you. You would be able to purchase very affordable, healthy, fresh fruits and vegetables there, because that's one area that we believe access to fresh foods can also help that individuals prevent the obesity epidemic. We also work within workplaces to make sure that employers are helping their employees be the healthiest they can be. We work within schools and also within the faith-based community, how we can partner together to maybe change some of the meal offerings offered at church meals. Simple things that we could do together. We created a healthy Latino and African American style cookbook that takes traditional recipes and makes them lighter and healthier. We worked with San Juan Baptista, Bright Sides Baptist, and some other churches to create these books. So again, another resource to just simply change some of your ingredients and make them healthier.
Really, thank you very much for all this contribution, because we don't need to set hard goals to fight and achieve great results. Simple things that you said could help at home in our community. So you recommend some final recommendations at home, for example, to sit down and eat meals together, right? To get enough sleep. Maybe we are not sleeping well, and the limit screen time. What do you mean about that? I would like to, our community knows what really means that.
Screen time includes television, it includes video games, computers, anything that you would be doing that you're sitting down. So limiting to no more than, is it 2 hours? 2 hours a day for your children and yourselves is a really good place to start.
Yes, the more than 3 hours to 5 hours spend our children in computers or TV or video games, and at the same time snacking, eating, you know, so that's really bad. So una recomendación final sería que limitemos el tener ese tiempo dedicado a veces a la pantalla, que puede ser a través de la televisión, pero sobre todo las computadoras y los video games que son tan populares ahora. Por eso tenemos que tener mucho cuidado en que por lo menos sea de 1 a 2 horas a lo mucho diaria. Algunos recomiendan 7 horas a la semana, incluida todos los 7 días. Something else that you want to add, please?
Sure. Just a couple more tips on reaching a healthy weight. Another thing you can do is not skip breakfast. So having regular meals is really important for overall weight management. And limiting the drinks that you drink to only water or skim milk, low-fat milk, is a really easy change to make, because other drinks that we're drinking, juice, soda, energy drinks, vitamin waters, all of those things have a lot of sugar in it. So some more than 13 teaspoons and on up. It depends on how much you're drinking. So really easy change to make is just get rid of the soda, the other drinks, the tea, the lemonade, and drink only water or low-fat milk. And don't skip breakfast.
Water and water.
Water, water, water.
Yes, well, it's very hard to me, but I'm really started, and I'm really, I think, doing a good job.
It would help tremendously in cutting extra calories and improving the nutrition just of the diet in general. And if you do have a child that is overweight and you want to consider coming to one of our programs, we've got a Shape Down program that is designed for children and adolescents between the ages of 8 and 18. And we are a 10-week session that teaches about healthy lifestyle choices. It includes a lot of nutrition information and physical activity guidance, and most of our families benefit tremendously from coming. So if you want more information on that, you can go to our Lancaster General Health website as well and look for Shape Down.
Muy bien, ahí tienen ustedes la website y también los servicios y programas al alcance de usted en nuestra comunidad. Agradecemos nuevamente a Beth Schwartz and Jessica Hildebrand. Thank you for coming, to you and your family. And I'm sure it's not going to be the last time.
Thank you for having us.
Thank you.
Thank you. Y con usted y su familia, hasta la próxima. Muchas gracias.